This episode of AMSAtv is brought to you by the Medical Schools Outcomes Database Project.
Welcome to this episode of AMSAtv. This year, hundreds of medical students may miss out on internships in Australia. AMS has been running a comprehensive campaign on this issue. Today, we'll be talking to Professor Lesleyanne Hawthorne, who's conducted research into the intentions and interaction of international medical students in the Australian healthcare system. Professor Hawthorne utilises data from the Medical Students Outcome Database, the world's first national longitudinal tracking program for the educational and career trajectories of medical students. Every medical school in Australia and New Zealand participates in the MSOD, and its data is useful for medical workforce planning to prevent and manage crises like we currently face. We'll also be talking with the chair of AMSA's International Students Network. But first, let's meet Professor Hawthorne.
So, Professor Hawthorne, thank you very much for taking part in this episode of AMSAtv. First, how have international medical students gone in accessing internships in Australia?
Well, frankly, it's been a roller coaster. So Australia has never guaranteed internship places to international medical students, and every medical school knows that. However, in the past decade, we've had shortages of students to fill those places. And in that context, by a couple of years back, in fact, 100% of eligible international students who qualified in Australia and wanted to stay on actually got an offer. Therefore, people had a genuine understanding that even though it wasn't guaranteed, they would get those places. No one ever put that guarantee in writing, but there was an expectation because earlier cohorts of students were being able to stay on. And that's become very problematic because now we're in the middle of the crunch time where we've got what's termed the tsunami of domestic medical student graduates needing to get guaranteed places at a time where suddenly international students are fearful it won't be possible for them. In terms of the study I recently did with colleagues for the medical deans of Australasia, we actually showed that 78% of international medical students have been staying on, but they need the internship pathway to get them the visa status and full accreditation so they can do that.
And for those interns who do stay in Australia, where do they end up working?
Well, I think the first thing to note is that they're showing great flexibility. So while it's very clear most of them would like to be in a city like domestic graduates, when you look at the first year data, 60% are in regional or more remote sites. So they are very willing to work wherever they're needed. Secondly, the government has got controls over where they work. Because most of them are on a temporary sponsored visa at that time, you can make it a condition of the visa that they work in an undersupplied area, which is a great plus for Australia. And the third thing to note in terms of it is that a lot of the students are motivated to stay longer term. While some will clearly go home, many of them say they want to live in Australia, they're willing to move states, so it's potentially a very large resource for Australia.
In your view, what are the likely impacts on the Australian healthcare system if there are insufficient numbers of internships for the number of medical graduates we're producing in Australia?
Well, the way I would see it is that really it's a lost opportunity. So basically, Australia is in a situation where importing every 5 years at least around 20,000 international medical graduates. And while some will have a very easy transition into employment in Australia and indeed get full registration, many will struggle for a number of years to achieve that. By contrast, we know from the research we've done that international students are highly acceptable to local medical employers. So within 4 months of graduation, 99% are employed full-time in medicine. That's virtually identical to the Australian born. Secondly, they've self-funded to meet Australian medical accreditation norms. And in addition to that, they're young. So the average age is about 24. Their productivity over a lifetime, if they stay in Australia, seems likely to be very substantial, whereas the average international medical graduate might arrive at about the age of 40 years and then take quite some time to get through the accreditation hurdles.
And what are the impacts to the Australian tertiary education system?
Many universities in Australia have medical schools which are highly dependent on international students for their basic resourcing and indeed to support the funding for the courses for all students. There is typically about a third of the student body who are international students. They pay, as we know, around $200,000 or more in fees over the life of their course. So that's an enormous resource to cross-subsidise the training, the infrastructure and the quality of the curriculum for all the students involved. Medical deans are deeply concerned, without question, that if there aren't going to be internships available for international students, they might choose to enrol elsewhere. And I certainly know from work I do globally that governments in Singapore and New Zealand, for example, are very interested in recruiting our international medical students who've qualified in Australia if we don't have the places to help them stay on.
So, Professor Hawthorne, do you think the current practice of employing overseas trained doctors to fill positions in hospitals is sustainable?
In the interim, we cannot negate how important those international medical graduates are, or their willingness to work often in very remote sites with poor infrastructure. The issue really is that everyone needs that 12-month supervised practice place. They have a very valid argument to say they also deserve such places because they're fully qualified, even though perhaps not fully registered in Australia. They are often here on a permanent resident basis. Some are citizens, and some have taken years to pass the AMSA exams to get full registration. At the very end of those years, they need that 12-month period of supervised practice. And it's most unfortunate that because of the lack of places, there is now a competition between two very important groups.
Thank you very much, Professor Hawthorne, for your time today. Much appreciated.
My pleasure. Thank you.
And now let's hear from Blaise Wardle, Chair of AMSA's International Students Network.
The ISN is AMSA's International Student Committee. It's made up of the international student representatives from the 14 universities in Australia that currently have international students. Our goal is to be the primary source of information and the primary advocates for all the international students currently studying in Australia. Yeah, right now our primary goal is internships for international students. I am applying for internships here. It's been a big source of stress and worry for the past 4 years. The idea that I might graduate this year and not have a job is pretty terrible.
AMSA continues to advocate for there to be a quality internship position for every graduate at an Australian medical school. In the past months, we've seen the shortfall fall from an estimated 500 to almost 250. For up-to-the-minute updates, check the AMSA website.
To find out more, visit us at www.amsa.org.au or contact your local AMSA rep. Thanks for watching this episode of AMSA TV.